Hello, thank you for taking the time to listen to this recording of Generation RX, presented by the Prevention Department at the Center for Alcohol and Drug Services. I'm Ellie, one of the prevention specialists, and will be your presenter today. My Generation RX encourages teens to incorporate the Generation RX messages into their individual, everyday lives. These messages focus on preventing prevention drug misuse by talking with teens about how to safely use medications and how to turn down invitations to misuse, as well as identifying positive alternatives for coping with the demands of life. Today, I'll deliver a presentation that discusses these messages. Let's begin by establishing the beneficial impact of prescription medications. Prescription medications can help us lead longer and healthier lives when used under the supervision of a healthcare professional like a pharmacist or doctor. Our life expectancy is the longest in history, and people are now able to live with many diseases that once were fatal. We are preventing or curing many illnesses and relieving troublesome symptoms, in part because of prescription medications. Medications can help us, but only when used as directed by a healthcare professional. Medications can be harmful, especially when misused. Before we move forward, let's define prescription drug misuse. Here are 3 scenarios. Scenario 1. An individual takes medication to help them study. Scenario 2. An individual prescribed an opioid pain medication is in severe pain. The patient takes more than instructed to manage their pain. Scenario 3. An individual shares their prescription medication with a friend. Which scenario do you think represents prescription drug misuse? Take a moment to discuss this with your peers. If you said all 3, then you are correct. In each scenario, prescription drug misuse is represented. In scenario 1, the individual is taking a medication for a different reason than prescribed. Medications are not prescribed to aid in studying. In scenario 2, the individual is taking more of the medication than prescribed. It's often the case that people misusing are not doing it on purpose. However, these actions can still be harmful. Lastly, in scenario 3, the individual is sharing their prescription medication with someone else. Even if your intention is to help a friend or family member, sharing prescription medication can be dangerous. Therefore, we define prescription drug misuse as engaging in primarily 3 behaviors: taking more of a prescription medication than prescribed, taking a prescription medication for a reason different than prescribed, and sharing or taking someone else's prescription medication. And, as we noted on the previous slide, regardless of our intentions, engaging in any of these behaviors is misuse. Now that we understand the behaviors that define misuse, what do you think? Do the majority of teens misuse prescription medications? Discuss this with those around you. The answer is no. Majority of teens do not misuse prescription medications. Actually, 6 out of 7 teens do not misuse prescription medications. This suggests that only 1 in 7 teens, or roughly 15%, have misused prescription medications in the past year. Even fewer do so regularly. This certainly isn't the majority. Never feel like you are not normal or you won't fit in with your peers if you don't misuse. This simply isn't true. But what is true is that prescription drug misuse remains a problem nationwide, including in many of our communities. Drug overdose deaths, primarily from prescription medications, is the leading cause of accidental death in the U.S. Clearly, misusing prescription medications can be harmful to your health. In addition, selling or taking someone else's prescription medication is a felony offense and punishable by jail time. The most commonly misused prescription drugs include opioid pain medications like Vicodin and Oxycontin, sedatives such as Xanax and Valium, and stimulants, which are Adderall and Ritalin. The good news is that you can make a difference. Take a moment to brainstorm and share ideas with your peers on how you can make a difference. How can you make a difference? You can easily make a difference by incorporating 3 safe medication practices into your daily life. Follow instructions, keep for yourself, serve as a good role model. Let's discuss these practices in more detail. We'll start with keep for yourself. Some items aren't meant to be shared. Would you share your toothbrush or your underwear with someone? Yuck, of course not. Prescription medications aren't any different. Prescription medications are intended to be used by the individual whose name is on the prescription. Just like your underwear and toothbrush, prescription medications should be kept to yourself and not shared. Why not? Why do you think we shouldn't share medications? Talk as a group about this question. There are several reasons. Our genetics, existing medical conditions, current medications we may be taking, even our age and weight can all determine how we respond to medication. And that includes not only how we respond to the therapeutic effects, but also to the negative side effects that can be harmful. Genetic risk factors increase the propensity to develop a physical dependency or addiction to a drug do exist. How your friend's body handles a medication is not telling of how your body will handle the same medication. In addition to keeping medications for yourself, we should also follow instructions and take prescription medications as instructed by a healthcare professional. Let's talk about this practice a little more. So some instructions are meant to be followed. When it comes time to apply for admission into a college or university, you're likely going to read every instruction on the application. Why? Because failing to follow instructions may lead to an undesired consequence, like not being accepted to that university. Likewise, athletes are required to play sports according to a set of rules. If they don't follow the rules, they're penalized. Prescription medications are similar. When we don't follow the instructions provided by the healthcare professional, undesired consequences can occur. You may be thinking, but why? Why do I need to follow instructions? Consider this prescription label for the opioid pain medication, Vicodin. As mentioned earlier, prescription opioid pain medications are among the most commonly misused prescription drugs. The instructions state, take 1 to 2 capsules by mouth every 8 hours as needed for arm pain. Instructions on prescription medications consist of 2 parts. Part 1, how much of the medication, the dose, and how often you take the medication, the frequency. Part 2, the reason for taking the medication, the indication. Sometimes the reason may not appear on the instructions, but the prescription was written by a doctor to provide a specific intended effect, like to relieve pain in this example. Instructions are provided to keep us safe. When we don't follow instructions, we increase the likelihood that negative side effects, including developing a dependency on some other medications, can occur. Some people misuse prescription medications by taking them for a reason different than prescribed. Discuss with your peers reasons teens give for misusing prescription medications. Possible reasons include to manage stress, to improve academic performance or help in school, to cope with feelings of depression, to deal with a physical injury in order to perform in an athletic event, known as play through the pain, to have fun, or to have something to do, like boredom, or try something new, as in curiosity. Now that we've identified common reasons for misusing, let's consider some positive alternatives. Brainstorm positive alternatives with those around you. I will be sharing positive alternatives that teens might suggest. It may be tempting to misuse prescription drugs as a quick fix to help you cram for an upcoming exam. However, this isn't a sustainable approach for earning good grades. Try studying with friends, work with a tutor, or meet with your teacher before or after school. If your mood feels depressed, confide in a trusted adult. Resorting to misusing prescription medications or using other substances will only prolong your feelings of depression. If you are an athlete experiencing an injury, you may feel pressure to play through the pain. However, the possible consequences from misusing a prescription opioid pain medication are far more devastating than not performing in an athletic event. If you are dealing with an injury, work with an athletic trainer or healthcare provider to safely plan your recovery. Boredom can affect all of us. Try curing your boredom by engaging in something you enjoy, like art, sports, or helping others. Stress will always be present in life. Try adopting healthy habits for dealing with stress, like exercising, watching TV or a movie, or taking a nap. Let's recap. You can make a difference and prevent prescription drug misuse by keeping medications for yourself, following instructions, and lastly, by being a good role model. This includes modeling these practices at home and encouraging your friends and family to do the same. In addition to serving as a good role model, we encourage you to share this information and help others. How can you help others? First, you and other adults can learn more about this issue by visiting the Learn section on generationrx.org. Second, you can share these messages with others. This may consist of discussing these messages with friends and family or sharing these messages through peer-to-peer education. Visit our website, generationrx.org, to access free, ready-to-use resources designed to educate teens. You could present this program or a different activity. You could also present similar educational programs to other audiences, like young children, using our age-appropriate resources. Lastly, if you are concerned about someone you care about, we encourage you to talk to a trusted adult. In addition, we've identified additional resources for helping others on generationrx.org. Thank you for taking the time to educate yourself on prescription medication today. If you have any further questions or comments, feel free to reach out to us at the Center for Alcohol and Drug Services. Have a good day.